Now we are going to see the field triage decision scheme, which this is going to be a flux diagram to take the decision if the injured patient is needed to be transferred to a trauma center or other facility. So we begin with the event and then the questions, first to decide if the patient needs to be transferred to a trauma center. Depends on the vital signs and the level of consciousness. So here we ask what is the Glasgow Coma Scale. If this is less than or equal to 13, the patient needs to go to a trauma center. If the systolic blood pressure is less than 90 millimeters of mercury, the patient needs to go to trauma center. Or if the respiratory rate is less than 10 or greater than 29 in adults, or in children less than 20. So if level of consciousness is less than Glasgow Coma Scale less than 13, or blood pressure less than 90, or respiratory rate less than 20 or greater than 29, independently of everything else, the patient needs to be transferred to a trauma center. So this is a question mark. This is what a rhomboid means. So these are questions, and if this is yes, then the patient needs to go to the highest trauma center. If don't, so if the answer to this is no, the answer to this is no, then I will put it here. If the answer to this is no, then we need to evaluate the severity of the lesions. So no. Now next evaluation is severity of lesions. Severity of lesions. So if the patient has a penetrating injury, in the head or the neck or the chest or in the extremities proximal to the knee or the elbow. All this implies that the patient needs to go to a trauma center, even if this does not apply. Another consideration is if the patient has more than 2 fractures in long bones, specifically in the proximal segment of the bone. Proximal segment. So more than 2 proximal segment long bone fractures. Another is that the patient has abnormalities or deformity of the chest, because this could suggest that the patient is having a failed thorax. Another consideration is if the patient has an open or depressed skull fracture. Basically, this, even if the blood pressure is not less than 90 or respiratory rate is not less than 10 or greater than 29, if these criteria met, then the patient needs to go to a trauma center. So if the answer to these questions if the answer to this is yes, then the patient needs to go to the highest level trauma center. If the answer to this is no, then we evaluate for the mechanism of the lesion. So next is evaluation of the mechanism of the lesion or the injury. So again, the question is, if talking about falls, if an adult patient has fallen from a height greater than 6 meters or 20 feet, or if it's a children, if the children has fallen from a height greater than 3 meters or 10 feet, I mean half of the adult, or if the children has fallen from a height which is greater than 2 to 3 times the height of the child. So if this is met, even though this don't or this don't, the patient should go to a trauma center. Maybe not to the highest level trauma center, but to the trauma center. Another consideration is automobilistic collision. So here, if we have that a passenger died, this suggests a high impact collision, so the patient should go to a trauma center if a passenger died. Another is if we have intrusion, including the roof of the car, for more than 12 inches in the side of the side where the patient was located, or more than 18 inches in any other side. This could be lateral to the side of the patient, this could be behind of the patient, or this could be on the side of other passengers that not be the patient. 12 inches correspond to 30 centimeters, 18 inches correspond to 45 centimeters. Another is that used by data telemetry, I mean speed. This suggests a very high risk of having a severe lesion. Another consideration is if we have if the patient was in a motorcycle and the motorcycle collides or has a collision at greater than 20 miles per hour, more than 20 miles per hour, which corresponds to 32 kilometers per hour. Also here, if the collision was to a velocity more than 20 miles per hour or 32 kilometers per hour. Also, if we have a collision between an automobile and could be a bicyclist or pedestrian, if the pedestrian or the bicyclist gets thrown, or they crash to a velocity more than 20 miles per hour or 32 kilometers per hour, then they should be transferred to a trauma center. So if the answer to any one of these questions is yes, then the patient should go to a trauma center, maybe not the highest level trauma center, but to a trauma center. If the answer to all of this is no, if the answer to all this is no, so next we need to evaluate for special considerations or special population and certain considerations of the facility to which we are going to take the patient. So we evaluate if we have an older adult patient, the risk of this is that after 55 years of age, the patient has an increased risk of having a severe lesion or death. So maybe the patient should not go to a trauma center or a the highest level of trauma center, but if he's an older adult which has increased risk of death, maybe he could be transferred to a trauma center. So this is like taking special consideration, special population. Also, if we have a patient which has more than 65 years of age, this patient has risk of having a severe lesion even with low impact collisions. This could be low impact collision, could be a fall from their own height. Or also if we have an older adult and we have blood pressure like 110 or less than 110/65, this could seem normal for a young adult. But in the case of trauma and being an older adult, this could suggest the patient is in shock. So this low pressure 110/65 in a traumatized older patient is not normal. This suggests a shock state. So for this, or having this in consideration, we could suggest transfer the patient to a trauma center or a facility that can take care of these important lesions the patient is having. Another consideration is children. Maybe we does not meet the criteria for transfer of children to the transfer center, but the triage of a children should be done in a trauma center. Which is specialized for pediatric population. Other consideration is if the patient is taking anticoagulant medication, or if she or he has a blood disorder. Because so the patient has an increased risk of bleeding, and if the patient has a traumatic brain injury, here the risk of bleeding is increased because of the patient taking anticoagulant medications or blood clot disorders. So here the risk of bleeding from traumatic brain injury is increased, and so we should consider taking the patient to a facility that can take care of this. And other consideration is if we have a burn patient. If the patient just gets burned, we should transfer the patient to a burn center facility. If the patient besides the burn also had trauma, so the patient should be transferred to a trauma center facility. Or if we have a pregnant woman, more than 20 weeks of gestation, then she should be transferred to a trauma center or a facility that can take care about this special consideration. And the other is the personal consideration of the paramedic or the person that first met with the injured patient. So if the answer to this is yes, the patient should be transferred to a facility that can take care of this patient. It is not any facility, or in this case to the trauma center or burn center facility. So the first decision to transfer a patient to specifically a trauma center is based on the vital signs. So here we measure the vital signs and the level of consciousness. If glucose scale less than 13, blood pressure less than 90, or respiratory rate less than 10 or greater than 29 in an adult, or children less than 20, the patient should be transferred to the highest trauma center. If the patient does not meet this criteria, but the patient has a penetrating injury in the neck, head, or the extremities proximal to the knee or elbow, or in the chest, the patient should be transferred to the trauma center. If the patient has more than 2 fractures in the proximal segment of long bones, should be transferred. If the patient has a deformity in the chest, should be transferred to the trauma center. Or if we have an open or depressed skull fracture, the patient should be transferred to a trauma center. Or if we have extremities without pulse, or crushed extremities, or the gloved extremities, or if the patient does not meet this criteria, then we evaluate for the mechanism of the lesion or the trauma cinematic. If person have a fall, if the patient is an adult and have fallen from more than 6 meters or 20 feet, should be transferred to a trauma center. Children more than 3 meters or 10 feet, or 2 to 3 times their about a car collision or automobilistic collision, if one passenger died, or we have intrusion including the roof of more than 12 inches or 30 centimeters, or 18 inches or 45 centimeters in other side that not be the closest side to the patient, it should be transferred to a trauma center. Or data telemetry that suggests high impact, the patient should be transferred. We have a motorcycle that collide to a velocity higher than 20 miles per hour or 32 kilometers per hour, should be transferred. Or if we have a collision in which a bicyclist or a pedestrian gets thrown, or the collision was to a velocity greater than 20 miles per hour or 32 kilometers per hour, should be transferred to a trauma center. If this does not meet, then special consideration is if we have adults older than 55 have increased risk of death or lesions, severe lesions. If a patient has more than 65 years of age, even with low impact collision, could have a more severe lesion. Or blood pressure less than 110/65 suggests shock in an older adult. If we are talking about children, it should be triaged in a trauma center. If we have a patient taking anticoagulant medication or blood clot disorders, the risk of bleed from a traumatic brain injury is increased. If we have a burn patient, the patient should be transferred to a burn center, but if also has trauma besides the burn, the patient should be transferred to a trauma center. If we have a pregnant woman greater than 20 weeks of gestation, should be transferred to a facility that can take care of this patient. And so this is the Flux diagram of the decision making about taking the patient to a trauma center, or specifically which care facility should be taking care of the patient. Also, it happens that many times the trauma center is to a very long distance, and we have a clinic or a center that could take care of the immediate highest risk lesions the patient is having, and eventually that facility should transfer the patient to a trauma center, but maybe primary care should be in other center, but not should be, but could be in other center, taking care of, for example, a pneumothorax or a hemothorax, and after the patient is stabilized or hemodynamically stable, the patient should be transferred to a trauma center. The best is that if this apply, the patient gets to a trauma center, but if that is very long away from where the event happened, maybe the patient is or could be transferred to a closed facility, get hemodynamically stable there, and then transferred to a trauma center.